Good evening, welcome to First Aid for Families with Sarah. I hope you are well. I'm going live tonight to talk to you a little bit about adult CPR and how we can help somebody if we find that they're not breathing. Okay. I'm also going to talk a little bit around COVID because obviously that is a big threat at the moment globally. We can't get away from that. So what I want to talk about a little bit is how we can still help somebody but protect ourselves and our casualty or that person that's in need, from COVID-19. So what I'll do is I'll just wait a little bit longer, see if anyone jumps on. If you are there, then pop your names in the comments. Let's have a look, let's open up the comments. There we go, and I'll see them come up. I'm doing this on StreamYard, so if you want your comment to come up with your name, then you'll just have to accept through StreamYard that you're happy for that to happen, and then I'll see who you are, but I will see your comments anyway, so that's not a problem. Sorry I haven't been around for a couple of weeks. I haven't really got too much of an excuse really, it's just one of those things, but I thought it was quite important to pop in and talk about CPR and again what we can do around COVID and still being able to help somebody. Now, there are many reasons why somebody might stop breathing. Generally, it could be something to do with the circulatory system, it could be to do with the respiratory system. But what happened is the heart's been affected, and therefore the oxygen is not being pumped around the body. And so the body's failing, lungs are failing, that person is now not breathing. And without assistance, unfortunately, what would happen is that person will die. Again, many reasons why: heart attacks, cardiac arrest where the heart just stops, or the heart goes into something called VF, ventricular fibrillation. And if you look back on the defibrillator unit that we did a couple of months ago, we talked about that earlier on. But at the end of the day, casualties aren't breathing. Now, one thing that members of the public are always reminded that they can do to help is hands-only CPR. And what does that mean? It means that you carry out chest compressions without dealing with rescue breath. Now, it's always ideal if you can to carry out rescue breath, okay? But if all you can manage is chest compressions, then that's absolutely perfect. Right, so how do we establish if someone is not breathing? Okay, very simple. The first thing we need to do, oh, by the way, I haven't introduced you. This is Bob. He's fine. He's not feeling too good today, so we're going to hopefully sort him out. Okay, so to find out if someone's not breathing, the first thing you need to do is try and get their attention. Hello, hello, you okay? I've come to help you. We're not kind of getting a response here. So the next thing we need to do is open up the airway. And by doing that, place your hand on the top of their head and then lift their chin. So what I'm doing here is opening up the airway. And that might be just enough for someone to start breathing on their own. Okay. Next thing we do is to get our cheek down to their mouth. Okay. And we're going to look down their chest and we're going to try and feel and see for any breaths. And we'll do that for 10 seconds. Okay, it feels like a long time, but as an adult human, we breathe between 10 and 20 times a minute. So it's not that lot, and if not a lot, and if that person is not very well or unconscious, it will be laboured. Okay, so again, good 10 seconds to check. Now, if they are not breathing, we need to ring the emergency services straight away. Get someone to do it for you, okay, or do it yourself, 999 or 112. And the first question the emergency service is going to ask you when you get through to the ambulance service is, are they breathing? So no, they're not breathing at this stage. So they'll probably tell you if you could carry out CPR and they'll talk you through it. But what I want to do today is just show you briefly how you can do this. Okay, so what we have Bob's lovely chest here. And what we got between his nipples is the center of his chest. Can't find it here. All right. Another way of knowing where to place your hands is if you feel for the base of your sternum, so right at the bottom of your sternum there, put 2 fingers and then put your hand just above there. And that's pretty much where the center of the chest is. Okay. Now, Casualty is on the floor. If they're on something soft, you want to get them down on the floor, because what we want to do is be able to compress down on the chest, and with that what we're doing is acting as the heart. We're pushing the blood out of the heart, around the body and back into the brain there. Okay, we're reoxygenating the brain and keeping that person alive until the emergency services arrive. Now, if they're not breathing, the emergency services are going to be coming quite quickly. All right, so here, the palm of your hand, find the center of the chest. You're going to lose my head in a minute, okay? We come up, straighten your arms off, and what you're going to do is compress down on the chest. And we're going to go about 2 and 2.5 inches down. So it's about 2/3 of the chest cavity. So it's quite a long way down. Unfortunately, what you might hear is cracking of ribs. That's normal. That is probably going to happen. Okay, so don't worry about that. You've got to put the pressure through to about 2 to 2.5 inches. And what we're going to do is 30 compressions, okay? And we're going to do it to the rhythm of, I don't know, you've probably, Vinnie Jones, was it Staying Alive? There's another one, Bites the Dust, not appropriate, but keep that one in your head. Or Nelly the Elephant, if we want to go nice and safe. And that's the kind of rate that we want to do, okay? I won't sing, I promise. So we're going to do 30 of those, all right? Now, if we are going to go for rescue breaths, what we do is we tilt the chin up, we pinch the nose, and you breathe. And whatever you've got in your cheeks. 1, 2. Once you've done that, we're going back to do another 30. Okay, so we would continue doing 30 to 2 rescue breaths continuously until the paramedics turn up. Now, obviously, that's exhausting. Okay, so if there's someone around that can take over, brilliant. Okay, but just keep doing that. So 30 compressions to 2 rescue breaths. Right. If you do not want to do rescue breaths, all you would do is continual compressions. Just keep going. There's no need to stop. All right, so you just keep going to that same rhythm. So Nelly the Elephant, Another One Bites the Dust, whatever you're singing along to, you do the compressions that way. All right. Now, let's talk a little bit about COVID and dealing with, you know, somebody, let's say, in the street that's gone down. You're a bystander. You don't know who that person is. And you are worried about, you know, protecting each other from COVID. Carrying a face mask, stick it on. If you've got anything to put on your hands, gloves, bags, anything with a bit of protection, stick them on your hands. Now, what you can also do if you're doing compression only CPR, because it is up to you, all right, and it will be down to choice. If you're only doing hands only CPR, so just the compressions, then what I would do, all right, and this is recommended, is once you've got your mask on, you got your gloves on, then just put something over their face. All right, doesn't sound great, but what's going to happen here is as you're pressing down, as they're being forced out, so you've got droplets of saliva and water coming out, it gets caught in their mask, let's say, so the clothing or whatever you put over their face. All right, so again, that's how we can deal with somebody in this situation of COVID. All right, so again, it's thinking about protection, priority, finding out if they're breathing. Okay, so remember with that, it was to lift the chin and then check down on the chest there, trying to feel a breath on the cheek for 10 seconds. If they're not breathing, ring the emergency services and then carry out compressions, 30 compressions, 2 rescue breaths, back to 30 and 2. And if you're just doing hands only CPR, it's just continual compressions, 2.5 inches through the chest there, and keep going until the emergency services turn up. So, have you got any questions? So I'll see if anything pops up there. God, it's exhausting. Get out of breath. It's really hot in here now. Put the heating on. Now I'm regretting it. Let's see if there's any comments there. Let's have a look. I can never see where they come up. Not to worry though, if there's no comments now, that's absolutely fine, because what I'll do is when I look back at this, I'll see any comments up, and if you've got any questions at all, then please do. Now, if we can, we want to try and get help to someone that's not breathing as quickly as possible. We've got around 3 minutes. You know, it's a really key time there, about 3 minutes from that person not breathing until you know, it's starting to go very wrong for them. So the quicker we can do CPR, quicker we get the defib, the better the chance of survival. But also remember in the back of your head, you're not always going to save a life, but what you are doing is getting that blood flowing around the body so that the paramedics have a chance of extra life support. Okay, so you know, if we can do something is always better than nothing. Right, so I'd be worried about how low to push down. You're going to have to push down quite far. So it's about 2/3 of the chest cavity. So, you know, we are talking about, I think it's 5 centimeters, so 2 to 2.5 inches. So you're going to go right down there. Okay, don't worry about it, because at the end of the day, if we don't do that, you know, if we don't put some force down in there, then, you know, they're not going to survive. You're giving them their best chance. So don't worry about it. Just push down 2 to 2.5 inches. You're going to hear cracking of ribs, you know, so, you know, it's not nice, but you're potentially saving a life. Okay, right. I'm going to leave it there. I think my camera's gone a bit fuzzy. I don't know. I've gone out of focus. It's probably just my eyesight. Anyway, it was nice chatting to you. Any comments, leave them in the Facebook group and I will get back to you. See you later. Bye.